Good morning or good afternoon, depending upon which side of the Mississippi you're on. My name is Doug Bowman. I'm here with Oral Health Kansas, and we're certainly glad you joined us today. Today, we're going to spend about an hour talking about oral health coalitions engaging in civic action. So we want to thank the three members of the Midwest Collaborative, that being Oral Health Kansas, and Oral Health Michigan and Wisconsin. We also want to thank DentaQuest, our funder. We certainly want to thank our presenters who we'll introduce as their time comes up. And we want to thank you also for taking time out of your busy schedule for joining us. A couple of logistical points. The participants, for the most part, are going to be muted. If you have a question, you have two choices. You can put them into the chat box or the question box, or a third choice, you can save it for the question and answer session we have scheduled at the end of this transmission. Other than that, I think we're about ready to go. So having done the introductory remarks, I'm going to turn it over to Helen Hendrickson.
Doug, thank you so much, and it is really a pleasure to be here today. I am so excited to be talking about this in the context of oral health coalitions, because I do really think that talking about civic engagement is one of the most important conversations we can be having right now, because the midterm elections in 2018 can be big game changers for us, but also just generally it gives us a chance to think more deeply about our role in civic engagement and the opportunities we have to make policy change. So everyone on the phone is probably already aligned in recognizing that our oral health system needs big changes in order to eliminate dental disease, which is a preventable and treatable, almost completely preventable and totally treatable disease that nonetheless thousands and millions of people are suffering from every day. In order to get that policy change, our leaders are extremely important. Our elected officials are gatekeepers for the policies that we're actually able to enact. Next slide. We live in a democratic society, which only works when we all actively participate in the system and elect officials that actually represent us. And we also know that the communities that are most impacted by oral disease are also often disenfranchised from the voting system. You can add the text on this slide. There are three lines of text. As providers and advocates, getting involved in civic engagement to support your community to vote, it supports your mission. So, I think oral health coalitions are organizations in and of themselves, but we're also made up of a variety of providers and advocates. So I'm going to kind of speak to you from that perspective of the different ways that you as a coalition can be involved, but also you and your members can be involved individually, and you can support your members in engaging in civic action. In terms of advocacy, so there are kind of a couple of ways to get engaged in civic engagement. One is as part of your advocacy activities. So if you're already engaged in pushing for policy change or advocacy in any way, you can kind of integrate election cycles into your advocacy efforts to cultivate awareness of your issues with elected officials. So this can be sort of an ongoing part of your advocacy. Human service and care delivery sort of oriented coalitions or coalition members can sort of think about an agency-based approach to voter engagement, a voter engagement model, where many agencies' missions include an interest in sound public policies that support the communities they serve. Agencies can also have unique access and trust of people they serve, and even medical providers can include voter registrations in their patient packets, which is totally allowed by HIPAA. So there are a variety of ways for your members to get involved and a variety of ways for you as oral health coalitions to get involved together, which we'll hear more about from the coalitions in each of the states. So we often hear a lot of concern that from nonprofit organizations about engaging in voter engagement. Is this sort of proper or allowed for nonprofits? So I'm going to tell you what the IRS officially acknowledges, that this is a quote: charities are allowed to conduct nonpartisan activities that educate the public and help them participate in the electoral process, such as voter education, voter registration, get out the vote drives, and candidate forums. So you need to be, the main thing is that 501c3, so you are totally allowed to engage, to do voter engagement activities. The main thing to recognize is that 501c3 organizations may not conduct partisan activities, meaning they can't oppose or support any specific candidate for public office. So this means, no endorsing candidates. You can't make contributions to candidates in any way, including letting them use your space if you're not letting all the candidates use your space. And you can't do anything that sort of rates candidates on who's most favorable to your issues. There are, however, a wide range of nonpartisan activities that 501c3s can engage in, including voter registration, get out the vote, candidate forums, distributing nonpartisan sample ballots, candidate questionnaires, or voter guides. It's also important to remember that individuals outside of work time are free to volunteer for candidate campaigns and engage in other partisan political activities, but you have to be really clear about the distinction between personal and professional efforts, as all of the voter engagement activities on behalf of the nonprofit needs to remain completely nonpartisan. So next slide. I'm just going to walk through a couple of the specific ways in which you can engage in, sort of to give you an overview of the different types of activities or buckets of activities. So I'm going to group this into two basic buckets. So one is voter registration or get out the vote activities. And so this includes, in every state, I think the first step to making sure folks can vote is to ensure that they're on the registered voter rolls. There's always a deadline that, significantly before the upcoming election in which any voter that's going to, be listed on the polls needs to be registered. And oral health coalitions can play an active role in supporting registration of individuals. And then, really like the registration is just the first step in getting to the ballot box. That the next piece is sort of supporting people to get out the day of the polls, both in terms of like there are a couple of ways people do this. One could be pledge cards or making calls, sort of reminding people that they want to get to the polls and that it is election day. And the other is sort of providing really tangible supports to do it, like transportation or childcare or other things that can be a barrier for individuals to get to the polls. Next slide. Another significant way that oral health coalitions can support voter education, support people to engage in in the election process is voter education. So if you can click forward a couple of times and add the text on this slide, that'd be great. A couple of things you could do is you could I think the real thing for nonprofits here are framing for oral health coalitions here is that you want to be able to give your membership base and the people in your sort of world some information that they need to make an informed choice about who to vote for. So you don't want to be partisan in this, and you can't say, this person serves our issues, but it gives you an opportunity to make sure that oral health is something that people know where these candidates stand on, and can make, and healthcare generally, and can make informed choices. Raising oral health within the context of the election also puts it on the sort of in the minds of the candidates themselves, and can be really powerful in terms of getting them ready to hear your issues when and if they're elected. So a few ways you can do this is you can host or co-host a candidate forum in which you invite all the candidates and you ask them questions, give them an opportunity to talk about the issues you care about in front of their communities. You can attend candidates' pre-planned events and ask questions of those candidates and give them a chance to talk about your issue and hear about your issue. And you can organize oral health related questions to be asked at these events. Next slide. So if you can add the text to the slide, that'd be great. So just a few things about voter candidate questionnaires. This is an opportunity where you'd ask the candidates to answer a bunch of questions. You just need to make sure there are a couple of rules to make sure you're sort of within the nonpartisan realm. You make sure you cover a broad range of topics, ask clear and unbiased questions, make sure all the candidates have an opportunity to respond. And if someone doesn't respond, then make sure you indicate that you asked them and that you didn't get it back. And then you can promote the answers to constituents and partners. Next slide. So I just have on these slides 2 examples of the ways you can, format these voter guides in order to be helpful. So this is an example of one in which long text questions were asked, and the candidates, you could use sort of snippets of those text answers to identify sort of how the candidates responded. Next slide. And then there's an example, once that slide comes up, of a voter guide in which it sort of just indicates if a candidate supports or does not support a particular initiative. So again, this isn't meant, you're not allowed to say, this person you like or don't like for the issues. This is simply the thumbs up and thumbs down is, do they support this issue or not? Next slide. So and you can add the text on that slide. So there are a bunch of organizations that are really supportive, really have a ton of information about how to engage in how to support civic engagement in your community that can be really useful to oral health coalitions. Here are a few on my slide. And with that, next slide, and then the next slide, I'm going to turn it over to Melissa Burrows to help us think about the specifics of the 2018 election, what's at stake, and how we can specifically engage at this time. So Melissa, take it away.
All right, thank you, Helen. And we can go into my first slide. Great. So first, not super specific, but reiterating some of what Helen was saying in terms of why these elections matter and why we're thinking about it as we are all thinking about oral health policy and oral health policy change. The fact that, as a network of people that care about oral health, as coalitions, we're all working on messaging that's related to promoting oral health policy. We've started to work around mobilization, and our mobilization is getting towards policy change to get us to our goals. And if we are going to work through that model, we also have to remember that to raise our issue through our messaging and our mobilization, we need to be getting to policymakers that care about oral health issues. And to get there, we have some elections that are both raising issues and choosing the policymakers that are making decisions. So that's really why we're focused on this and why it's exciting right now. And then go to the next slide. I'll talk more about 2018 elections and why we're specifically really at a critical point to get engaged this year. So this year, 2018, the entire House of Representatives is up for election. A third of Senate seats across the country are up for election. At the state level, 36 of our 50 governors are up this year. Many state legislators are being elected this year in state chambers across the country. And then, of course, there are also local elections that are deciding things like boards of education and county commissioners and all kinds of important local policymakers that affect our issues as well. And so this is a big opportunity for change. There is a lot at stake in terms of healthcare at large being a critical issue, making sure that oral health is part of that conversation, and also, just kind of seeing how this big turnover will affect, what people know about oral health, what they know about health in general, and making sure that we're prepared to interact with a whole set of new policymakers who may or may not know about our issues, and making sure that this issue is front and center for them. So, we know election day is November 6th. We also know a lot of primaries are happening over the spring and summer. So really now is the time to start getting engaged and doing a lot of these activities that Helen's mentioned, and I'm going to talk a little bit more about. So can you go to the next slide? So I'm just going to quickly run through a little bit. I started to allude to this, but why these elections matter. First of all, we know that oral health is often sort of left behind both in policy and also in public visibility, and elections provide a great platform to do that. It's also a time in which we can gauge candidates' receptiveness. Not only are we raising, issues in terms of voter education, but we're also educating our candidates and starting to see how much they might know, how much they are willing to get engaged, and if how much pressure they're going to need over the course of their potential tenure as a policymaker to really get on board with what we want to do as a community. It also is an important opportunity to demonstrate public support of an issue, especially an issue that is very well received and public supports when they know about it, but it isn't often elevated. So it's an important time to do that. And then the last thing is to remember that the elections matter both in terms of the opportunities provided to raise issues during the election, but also because they set up the foundation for what we're going to be doing in the future, how much, educating people once they're in office, the foundation for being able to take action once people are in office. And so it's really an opportunity to build relationships with people early before they even get into an office, so they know who the experts on certain topics are and where they can find respected sources of information. So at a high level, that's really what we want to be working towards. And now I'll talk a little bit more about specific activities in voter education. We could go to the next slide. So this is talking to candidates as part of voter education and also candidate education. Families USA developed a new tool, which is oral health questions to ask your candidate, which can support a lot of these activities that Helen was talking about. And so those are things like, candidate forums that you or your partners might be hosting. It can be town halls that the candidates themselves are hosting in which you want to raise your issues. It can be in things like the questionnaires and the voter guides. It can also be making sure that when other organizations are developing questionnaires, voter guides, or hosting forums, that oral health is being represented. So, some really powerful voices include AARP and League of Women Voters, and getting oral health questions in the, activities that they're doing, I think is a really important way to raise this issue alongside of other issues to really highlight its importance. And then, as Helen mentioned, once you have gotten responses to questions about oral health from candidates, it's really important to make sure that voters and partners and organizations and the media maybe, or just getting it out on social media, it's really important to disseminate those responses so that people can make informed decisions about the issues that they care about. So those are sort of some ways in which we're talking to candidates, and now I'll talk a little bit more about this new tool that can be helpful as you are planning on doing some of these activities in your advocacy. So next slide, please. So what this tool is really just a list of questions with some background information on how to get involved about questions you can ask your candidate about oral health in state level races or in national level races. And the framing of these questions is really to make sure that we are talking about oral health through the lens of things that what candidates are already thinking about. So what are candidates already thinking about as their election day comes near? They're thinking about budgets, sort of government budgets, whether that's at the state or federal level. They're thinking about what can money be invested in and what are the limitations of that. Candidates and voters are thinking a lot about healthcare affordability. So meaning for voters, it's, can I afford the care that I need? And sometimes they're thinking about that in the context of oral health, but sometimes they aren't. And so, drawing that connection is important since oral health is one of the least affordable services for in healthcare for people. There's been a good body of research that supports that, and that is the number one issue for a lot of voters, is being able to afford their healthcare. And then also for the government, can we afford to provide healthcare, and at what level is a constant issue. Candidates also may be thinking about sort of the national conversation around comprehensive healthcare. This is an ever-changing conversation, but given sort of the efforts around the repeal of the ACA last year, the response to that, all of that, there's a lot of discussion about these issues. And so it is top of mind for a lot of people. And then finally, candidates might be thinking about sort of Medicare and Medicaid. They might know the difference between those two. Some care deeply about one or both of those programs. But you'll want to provide context information, but they'll be thinking about coverage programs as part of, of budgets, of how they're really getting to people more so than in other areas. However, what candidates are not usually thinking about most of the time is oral health, why it matters, or who is affected by it. So kind of combining what they're thinking about with these things they're not thinking about is sort of the strategy we took behind these questions. I'm now going to go through 3 slides that are showing you examples of questions you could ask in any race, examples of questions you could ask at the national level, and examples at the state level. And so I won't read through all the questions, but these are examples of things. Feel free to use them in your work, to share them with others, to modify them as you need to for your state level context, and hopefully it is a useful tool for you. So if I could show the first slide for the questions for any race. These all work. They provide some level of background about why oral health matters, and then ask a specific question. Here we're linking it to, making sure that people understand the impact of oral health on overall health, and also making sure that policymakers are thinking about, or candidates are thinking about, the impact on oral health to healthcare affordability. And now we'll go to the next slide for questions for candidates. I think it's the national level. Yep, in congressional races. Here we're talking about who needs oral health coverage, and specifically that Medicare dental coverage would help address some of that major need, and also talking about the Medicaid program and its importance to oral health. Next set of questions on the next slide. And then these are for state level races, again, looking at sort of key issues and key programs that state level policymakers will be thinking about. And so that's sort of what we have in this tool. It's in a nice PDF. We can make sure you get a link after this presentation. And if you have any questions, I'll be happy to answer them at the end. And so now I will turn it over to a more on the ground perspective as to what folks are actually really doing in this space and how they're putting tools like this to use. Thank you.
Thank you, Helen and Melissa. We appreciate your information. And this is Doug once again in Kansas. And as you've mentioned, we'll hear about a state perspective from the good state of Michigan. I would like to introduce Shannon Keza and Ife Johnson. Ladies.
Hello, this is Shannon Keza, and I am the Oral Health Coordinator at the Kent County Oral Health Coalition. Our coalition is a partnership of community members, medical and dental providers, and community agencies collaborating to improve oral health outcomes and access to care for Kent County citizens. Next slide. So we're part of the DentaQuest Foundation's Oral Health 2020 network, and one of our goals as part of this network is by 2020, Michigan will have an improved adult dental Medicaid payment rate. One of our objectives towards this goal is increased outreach to legislators. Things that we have done so far to increase our outreach to legislators are we had the Michigan Oral Health Coalition come and train our entire coalition on their advocacy toolkit. We've been attending meetings of House of Representatives. We've been attending community meetings for our senators. We've been doing individual meetings with those senators, assistants and directors. And then just to provide general education to the public at large, our coalition member, and she is the co-chair. Her name is Colette Smiley. She's our clinical director, and she participated in a radio interview and advocated for Medicare and dental coverage within Medicare. And then something else that we were able to do just as overall education is participate in a web article. Carlene from the Michigan Oral Health Coalition, Tasha from Cherry Health, which is our FQHC, and I participated in an interview as part of an oral health disparities series to talk about oral health care access challenges and potential solutions. So these are the things that we've done so far. And I want to talk a little bit about when we've met with these lawmakers. Next slide, please. So when talking about Medicaid, we like to meet with at least either the assistant or the regional director for a senator. And then kind of the format that we've been following is to state the problem and its effect on the community and the constituents. We frame the problem with simple, easy to read data that's visual. And we kept it in the context of client stories and experiences so that it's relatable. So to the side, I have an infographic that we shared with one of our senators, Senator Peters, and it's visual, it's easy to read, it's clear, and it's memorable. It gives the highlights, and then we've just kind of framed that with stories about constituents who are experiencing a lack of care that is highly impactful on their life. So in addition to sharing data and sharing stories, we like to also include what the impact would be on the community if no action was taken, and then give a solution to the problem so that it doesn't seem like it's unsolvable. So in this case, when talking about Medicaid and the adult dental benefit, the solution that we gave is listed here, and it's made up of a balance of financial and non-financial reforms. So in our state right now, our reimbursement rate is very low. It's just over 20% of the commercial dental rate. And our reimbursement rate hasn't been increased since 1986. So we're really advocating to increase that, especially since data shows that reimbursement rates above 60% of commercial dental rates are significantly associated with increased utilization compared to those below 40%, and we're almost half of that. Other things that we are advocating for is just the complexity of Medicaid and dentists utilizing that insurance. So simplifying the administrative processes, helping to resolve barriers associated with submissions of claims, and then enhancing member education and engaging, educating, and enrolling dentists. Next slide. And then on the flip side, we've also been talking about Medicare and dental. So we've been providing education to the public and to lawmakers about the fact that Medicare doesn't cover dental, which can be a surprise. And then going through this same kind of pattern with lawmakers that we meet with individually, so letting them know the problem, giving them data in the form of an infographic so that they can take it with them, so that they can briefly look at it and understand the points that we're making, telling them a personal story of a constituent who is greatly impacted by the lack of dental coverage in Medicare, what the overall impact is on the community, because we want to make it relatable that that one situation that we're describing as a personal story is indicative of many stories. It's not an isolated incident. And then offering a solution. So in this case, the solution is oral health is integral to overall health. To live a healthier, happier, more productive life, older Americans need the ability to access oral health care the same way they access medical care through Medicare. And so after providing these elements to our lawmakers, we also give an ask. So framing the ask around the solution. Next slide. And then things that we still have to do yet, moving towards our goal, is one of our senators is Debbie Stabenow, and her region director has been offering Advocacy 101 trainings. And so we're going to bring her into our next Kent County Oral Health Coalition meeting just to build on the advocacy presentation that we received from the Michigan Oral Health Coalition. We've been inviting our entire coalition to attend these webinars. And we've been making sure that it's something that we really hit on at every single meeting that we have, just to build confidence around advocating, to keep it at the forefront of all of our coalition members' minds, and to engage them in participating in all of this. So it's not just a couple of members of our coalition doing all of the outreach and all of the face-to-face. We have community members who have been able to share their story, but we would like to take the step to bring them with us to these meetings, whether they're community meetings that lawmakers hold, or coffee hours, or individual meetings that we've arranged for. Something else that we want to do is work with our community partners to promote the importance of voting to their client and patient populations, and then join forces with state and local oral health coalitions to share, get out the vote information and to coordinate efforts there. So we're looking forward to implementing these actions along with what we have already done. Thank you.
Hi, my name is Ife Johnson. I'm with the Wayne County Oral Health Coalition in Michigan. And I wanted to take a slightly different approach. I wanted to talk a little bit about changing the flow of civic engagement, how we're actually accessing the points of contact to the community so that we can inspire the change. Next slide, please. I came across a couple of different definitions for community action. Next slide, please. The first one actually deals with the concept of community action being more of a project for short-term goals. Next slide, please. Much like the civic action that we take with Mission of Mercy. The other one is more comprehensive, the idea of being a collective action, of implementing rights and caring for the common good. Next slide, please. And most importantly, empowering the community. So how do we go about empowering the community to make this change? So we start looking at who our community contacts are, how do we engage them, how do we pass information through them to the community, and how do we create a move among that group towards civic action. Next slide, please. First, we looked for identifying points of insertion into the community. We partnered extensively with faith-based organizations, community-based educational institutions. We invited them to our table, but then we also used them to help us reach other folks in the community of like mind. Next slide, please. And after they extended the invitation to their partners, then we did the follow-up. We kept our partners engaged by creating 7 different committees around faith-based organizations, future leaders, seniors, public perception and advocacy, data collection and evaluation, fundraising, and community clinics, temporary clinics. We provided many grants to some, micro grants, and we developed memorandums of understanding to help connect us to the community. Our existing partners helped to identify folks who would be good for this and invited them in. We then created connections between the various committees so that our faith-based committee, for example, if they needed information on data, could work with our data collection committee. Next slide, please. The important thing was we started looking at how we pass information to our community through those points of contact. By providing, we developed actually a survey tool that could be distributed at faith-based organizations, and a number of our churches now are collecting information on the needs of their congregations and constituents. As a result, they're learning what is important to their church or their community group about oral health. So those are the issues then that become the policy issues that we prepare to take to our legislators in our area, and helps them connect directly to the legislators in a meaningful way. And it means that the folks at the church, for example, are willing to call their legislators on those issues that they have decided were important to them. Next slide, please. Then we actually create the movement. We create talking points for them based on what they said were important. We have published a list of town halls and coffee hours that are coming up in their area so that they can go and talk with their legislators. We're partnering with groups that are doing candidate forums and helping to create some of our own. We're getting people to use the 5 Calls app on their telephones to contact their legislators directly. We're participating with voter registration drives and GOTV drives, and we're keeping people engaged at a number of health fairs and oral health activities that are going on in our community to make them aware of the need to be active with their legislators. So that's a quick and dirty for Detroit. Thank you.
Thank you very much. And this is Doug Bowman, once again at Oral Health Kansas. And I'm going to talk a little bit about candidate forums. We have here in our capital city one of our more energized community-based oral health coalitions. And 2 years ago, at my urging, they went forward and had a couple of different events in that election cycle. They did candidate forums, one for the primary election in the summer and one for the general election in the fall. I can tell you that they're going to repeat that process this cycle with one notable exception. They didn't have any primary races to contest, to talk about in the summertime. So they're focusing their efforts on the general election in November. But let's talk about candidate forums in general a little bit. We found that it's a nice fit for coalitions because it's really important that you collaborate across boundary lines, across agency boundary lines, across organizational boundary lines. The more entities and the more people you can get involved, the better. You want to engage a large group of organizations to co-host your event. The wide range of sponsors implies a wider base of support, and a wider base of voters will turn out for the event itself. And it gives a little bit more credibility to the event. So among the organizations that, I mean, obviously you want to look at the people who are already sitting around your coalition table, but among the organizations that might not be at the table right now that you want to include in this event because of the nature of the event are some of the ones that you would think about: the League of Women Voters, the Chamber of Commerce, the United Way, the local bar association. Our local library is one of our co-hosts, our local university and other educational entities, hospitals and health organizations, mental health. You want to get as many people involved as you can because, like I said, it strengthens the event. It also helps spread the work around so that no one person is responsible for doing everything. So it's important that you do that you reach out to some of your other community partners to help you. Now, having said that, the flip side of that coin is that you probably, depending upon your community and depending upon your event, you probably can't be all things to all people. So you need to choose your jurisdictional and geography carefully, your boundary lines. Are you going to try to do the whole region? Are you going to try to do the whole metro area? Are you going to try to do the county? I mean, think about which geographic turf you're going to try to cover. You need to think about which races you're going to cover. All of the races are important, local, state, and federal, but it's a very challenging thing to do all 3 levels in the same event. You almost have to separate those events. So think that through as you're planning your event. But once you've made those decisions, you have to make absolutely certain that you invite every candidate that's going to be on the ballot in the races that you select. To accidentally drop someone off will be viewed as exclusion and will do you great damage. So it is critically important that all the candidates are invited. You need to then think about the logistics of the event itself, the time, date, and place. So, you know, thinking about the time in terms of avoiding conflicts with major things. You know, if you're going into the fall, you probably want to stay away from Friday night football or things like that. As you're picking your place, you want to think about the convenience for people to be able to get to the place. Is it on a bus route for public transportation so that you have a nice wide range of audience able to participate? Is there parking? What are the acoustics in the room? All of those kinds of things. Something I should have mentioned back when I was talking about the time, we found it also helpful to make sure that you hold the event before the onset of advanced voting. People are always focused on election day, but in many jurisdictions, there's an advanced voting period, and you probably want to have your event before those opportunities for advanced voting start. A critical decision that we talked about is picking your moderator. You want someone who's well-known in the community and viewed as a leader, but who isn't viewed as having a particular perspective or axe to grind. So you want to make sure that they're nonpartisan. You want to make sure that they're not viewed as leaning on one side of the fence or the other. Maybe a media personality, someone from the local paper, a school leader, a church leader. You know your community, think that through as you're getting ready. Important to use a timekeeper. We give our timekeeper not only a watch, but a couple of placards. One was an hourglass sign that says 30 seconds left, and the other was a big red stop sign. And then the timekeeper sits in a place where they're easily seen by the speakers, the folks who are doing the talking, and the moderator, but it's up to the moderator then to step in and enforce when someone won't shut up. Then you need to think through the format. We found that if you're going to allow self-introductions, that you very much need to limit the time limit. Otherwise, folks will get off on their whole life history and go on and on forever and ever. So give them a short amount of time, or maybe even better yet, just have the moderator introduce the candidates by name, position, and party. As you're looking at the format and the context of the whole event, you need to make sure that every candidate gets equal time. So you need to structure it. If you're going to have time for rebuttal after a question, then when the day is done, you need to make sure that the time is even, that no one side or the other didn't dominate the time. And then we also found that it's helpful at the end of the event to give every candidate a minute or two to wrap up. It's a chance for them to frame their message and maybe hit hard on a point they really wanted to make sure everybody heard. In the letter of introduction that we send out in advance when we're setting this event up, it's important to tell the candidates that they're invited to this event, but that you won't allow surrogates or proxies. If you don't tell them that in advance, what you run the risk of having is the campaign manager, or worse yet, the brother-in-law shows up and says, I'm here in Joe's stead and I'll be happy to jump to the mic. It's only fair. Candidates, it's a candidate forum. They should be the ones at the mic. We also found it helpful to have a little bit of time at the end so that you don't have to rush people out of the room and send them home for the night. For handshakes and informal conversation, and people are able to have some nice conversations informally at the end. We also found it helpful to have maybe some tables at the back of the room, and candidates can bring campaign literature, pamphlets, palm cards, that kind of thing. But once again, it needs to be equal access. You can't have that be available to one side and not the other. The glory of a candidate forum is that it doesn't go on and on forever. It's time limited. You're certainly going to have it done by a date certain. And I heard several people make the allusions about the importance of voters learning about candidates, but also candidates learning about the issues and the relationship building. I wanted to hit upon that. It was mentioned earlier, but I've had instances when freshman legislators would come up to me and say, I remember you from that candidate forum last summer, and you've started the conversation, you've started the relationship. And that's the most effective way to influence policymakers, is for them to view you as the local expert on this topic. So that's all I had to say. I was going to turn it over now to Rosie McGovern in Wisconsin.
Hi, thanks, Doug, and thanks everybody for tuning into this webinar. Like Doug mentioned, I'm Rosie McGovern. I am the project coordinator for the Wisconsin Oral Health Coalition, which kind of sits within the Children's Health Alliance of Wisconsin. So Doug, if you want to go ahead and click on the Children's Health Alliance page, perfect. And that'll take us to the Wisconsin Oral Health Coalition page. And then if you scroll down to the bottom, you will find amongst our many resources that we provide, we have the advocacy toolkit. if you want to click on that. Thank you. So our grassroots advocacy toolkit came from viewing the Michigan's advocacy toolkit, which you'll hear from in a little bit. We wanted our coalition members to be able to access their legislators and just have those tools available to them at kind of a one-stop shop location, and really just have the confidence to advocate for themselves and the different oral health, initiatives within oral health. If you want to just start scrolling down a little bit. Thank you. So on page 1, we have just this introduction letter. It has our chair and then the project manager of the Wisconsin Oral Health Coalition on it. And it really just explains that we would like people to use this for engaging their elected officials and informing legislators just about the importance of oral health and really helping shape those policy changes and impacting your overall and oral health. So if you want to keep scrolling down, the actual nitty-gritty of the advocacy toolkit is more of just that broad range of kind of what grassroots advocacy is, along with just the general structure of our government. So we have the federal government, the state government, and kind of what makes up local government. If you want to keep scrolling just a little bit, you'll see that there's live links within this advocacy toolkit because we really want people to be able to access their legislators within here. So there's in that federal government section is the link to the senators at that federal level, and then also the House of Representatives. And then there's a little paragraph for Federal and State Policy 101. It's basically just how a bill becomes a law. We wanted people to be able to, really understand kind of how that works, and just a quick snippet on that. If you want to keep scrolling down. We have the reasons to contact your legislator. So what I'm just going to highlight is to really develop that relationship. We want, our members of the Wisconsin Oral Health Coalition, but also just people in general, we want them to be viewed as that kind of lead experts and resource that legislators can look to when an issue does come up. We also just have highlighted some, request or recommend legislation on a specific topic, and to really be able to register your position on a bill or a specific topic as well, and then to weigh in on that state budget. If you keep scrolling down just a little bit, the Wisconsin state budget is a 2-year biennium, so we wanted to make sure that people kind of knew what that looks like and where their advocacy efforts could also lead to. If you want to keep scrolling down, there's just kind of different ways on how you can contact your legislator. So phone, email, mail. We have an entire section on social media in there a little bit later in the packet. And then just things to kind of remember. You want to make sure that you're personal so that your legislator knows that things are going on in your community and things are happening that are important to you and should be important to them. And then if you want to just keep scrolling down, we have just meeting with legislators and policymakers. And on page 6, actually, if you want to just keep scrolling down, we have, make sure you leave your contact information and send a thank you afterwards. You want to make sure that people remember you and remember what you're there for. So we have that. And then we have providing testimony as another kind of way that you can engage those policymakers, just highlighting the difference between a public hearing and an executive session, and that the public can attend and participate in public hearings, which is just, it's such an important way of getting involved and making sure that your voice is heard. And then just below that are just a few tips on providing a successful testimony at a public hearing. And then if you want to just keep scrolling to actually that last page, we have communicating with legislators on social media and how important that is, and that you can really have your voice heard by their staffers and then get to them as well directly. So I know I went kind of fast through that, but I know we're starting to run out of time. So if there are any questions at the end of this, I'd be happy to answer them as well. Thank you.
And thank you. And last and certainly not least, Patty from Michigan.
Thank you, Doug. You know, Michigan has policy priorities that we have developed. And one of the things that is most important to us is making sure that the local oral health coalitions that we've developed are educated about the policy priorities and part of the conversation, so that they're aware of the ways that they can advocate for change and to be a voice that can be heard. Next slide. So we do outreach with a lot of different groups to make sure that we have a state network that is broad-based and is effective for all people. Next slide. So we're building a network within our state. As Wisconsin talked about the advocacy toolkit, we have a Michigan advocacy toolkit that we use with people. Next slide. So we have a resource that's available to our constituency that outlines key Senate committees, House committees, approaches to how to connect with legislators, budget timelines. And the thing about the advocacy toolkit is that it is time reflective. So it needs to be updated very often because legislation change at a very fast rate. And so if you'd like to take a look at this, it's available at www.mohc.org. Next slide. One of the things that I'd like to share with you is planning resources and talking points that we've developed. I apologize if this slide is really hard to read, but I wanted you to get an idea of the format for this. The talking points are very interactive. They're very pointed. And one of the things that we've learned with messaging is that when you have points that you want to make, it's important to message them in the proper framework so that it really makes a difference. Next slide. So this is, I think, a pointed slide. When it comes to our state oral health, the choice is clear. You can pay a little to prevent or a lot to repair. And so these kinds of messages have an important impact because of the way that they're framed. And so this particular document will be available through handout, and we'll be emailing that to you so that you can take a look at it and see what this particular document looks like. And I'd like to thank you all for being a part of this conversation. You know, it's important to empower community members to make their voices heard by utilizing informed information about candidates who will work toward improving the oral health issues that are important to the well-being of all. And advocacy is really more than oral health. There are so many social issues that need to be addressed. And people can have a voice if they're given the appropriate resources, and our local coalitions can be a dynamic part of that process. So I hope that today you have taken away some ideas and information and inspiration for getting out the vote. And so we have about 5 minutes left. If there are any questions and answers that people have, you can use the chat box or the questions section.
Thank you, Patty. And I'm going to also urge anybody that wants to type very quickly in the chat box or the question box. And while you're typing, I've had one thing I wanted to mention at the outset, but I'll say it now before we hang up, and that's that we are going to endeavor to get these handouts back out to you as part of an email in the next day or so. So we'll get this back out to you and pretty them up a little bit if that be the case. So what do we have in the way of any questions over there? Nothing so far? We'll wait just a moment in case somebody's typing. I'm going to ask if Helen or Melissa would like to say any further words after having heard the words of wisdom from us at the local level.
This is Helen. I can start. And thanks for the invitation. It's been really a pleasure to hear this rundown of all the different ways in which oral health coalitions across the Midwest are engaged in civic activities to promote voter engagement and advocacy. And I just, for folks who are listening to the webinar and thinking, you know, what can I do? I would say, you know, sort of start where you are, that you've been given a sort of a menu of options and a framework for why it's important to get engaged. Start with a thing that feels approachable to you, and then build on the successes of your partners in oral health coalitions across the country. I don't mean to volunteer folks on the phone, but I know I'm happy to talk to anyone who's thinking about getting engaged and wants more information. I suspect anyone who presented today would be happy to share their insights and successes with you. So just do what you can is my message for the day.
Yep, that's great. And as I was working to unmute myself, Helen really covered, I think, even more eloquently than I would exactly sort of my sentiments. So, you know, thank you for including us in this, and it's really inspiring to hear what you're all doing, and I hope that it inspired some of the rest of you on the phone to start doing what you can. And like Helen said, I'm more than happy to be helpful in any way that I can be, and I imagine other folks on the call are too.
Thank you. And Doug, if you would advance the next slide, there's my contact information and eFaith's contact information if people want to get in touch with us about any of the resources that we've shared.
Very good. And Patty, while people are writing down your email address so they can send you a note, we do have a couple questions that came in. So
great.
I'm going to ask Sonia or Tanya, would one of you like to read?
Sure. This question is from Emily Furman. Does anyone have more specific examples of strategies for community water fluoridation?
Yes, I think that this is Patty from Michigan. I know we have a fluoridation toolkit that's available on our website. And gosh, Wisconsin, I think that you folks do as well. Is that correct?
Yeah, I was just going to say that as well. So if you visit www.tapintohealthyteeth.org, we have a community water fluoridation toolkit, and also it's a really vast website that contains a lot of really good information about community water fluoridation. So I can send that link to Doug and Oral Health Kansas, and they can get that off to you if that's helpful.
The other thing I would recommend is to go on Socius. The website is oralhealth.network. And if you're not a member, ask for a login. There's a wealth of information up there on just about every topic you can imagine.
This is Helen. I'll just add, in the spirit of thinking about elections and the opportunity for election, because fluoridation is a local level issue, it really invites you to get engaged in your local elections from, you know, mayor to city council to, you know, sort of your water board, participating in whatever the process is for electing your water board or appointing it. That these are all opportunities for engaging in, for thinking that priming your leaders to care about the issue that you care about and to approach it in the way that you would hope they would.
Very good. We have one last question we're going to try to squeeze in here before the finish line.
This one's from Catherine. Does anyone have any metrics for post Get Out the Vote initiatives?
Catherine, this is Helen. I'll jump in and see if anyone else has more to offer. This can be tricky. I think the two things I've heard people use, and I'm not an expert, but there are folks who are experts on this, but the two metrics I've heard used are some people do collect, voter registration cards and put them in themselves. In that case, you can count who registered. And then there are systems that give you information about who voted, so you can look at like your membership or the people that you registered or the people you contacted and count those against who voted, but it's very expensive to get access to them. And so I've heard of, there are some, I'll have to get the name and I can give it to folks to send out with resources after this webinar, but you can work with your state voting group and sometimes they'll work together to get access to those, to pay for those, roll call information. I'm not using the right language. And that way you can kind of get a sense of who from the folks you contacted or from your community voted and have some metrics that way. I'm sure there are better ways, but and I'd be happy to help talk to you about it afterwards and connect you with folks who have more detailed information.
Something that's very, it's not exactly empirical research, but we work, like I said, with a lot of the faith-based organizations. And we've actually, in some churches, as crazy as it sounds, the pastor will ask, register, and have them hold up their registration cards, who's getting ready to go out and vote, how many people afterwards actually did vote, that, actually will report back to the church. And that can give you some good information about what's happening.
Okay, this is Doug again in Kansas, and the clock on the wall says that we're a little bit over, so I think it's time for us to wrap it up. I do want to take time once again to thank all of my panelists for contributing their expertise. I also want to thank all the participants for taking time out of their busy lives and joining us. And I encourage you to go out there and get involved so we can slowly but surely get the public policy of this nation headed in the right direction. Thank you, everyone.